Welcome to the PUTTcast podcast by Pharmacists United for Truth and Transparency. Pharmacists United for Truth and Transparency is the only registered 501c3 nonprofit wholly dedicated to exposing the hard truths about pharmacy benefit managers and how their business practices are driving up drug prices and healthcare premiums while reducing consumer choice and endangering patient access. To learn more, visit our website at truthrx.org.
Hi, welcome to this episode of the PUTTcast, brought to you by Pharmacists United for Truth and Transparency. I'm your host, Lauren Young, Vice President of PUTT and supporter of one of our new guests to the podcast, but not a new friend to PUTT. Hi, Kris Rhea from Pharmacy Marketplace. How are you?
Hey, Lauren, how are you doing? So excited to be here.
Doing well. You have done a lot of podcasts to try to promote this issue that we're talking about, and I'm so excited to have you on ours today to share with our PUTT friends and listeners about what is going on, because I think this is so important. I know a lot of people look to PUTT as their help for PBM reform and how they can best get their advocacy message across. And Pharmacy Marketplace and what you guys are doing is really beneficial, and it's different in this space of advocacy and trying to help with PBM reform legislation. So I'm glad you're letting me kind of bend your ear a little bit and get some more information behind the curtain. Really appreciate that.
Yeah, definitely. You guys are so passionate, and your audience is so passionate about PBM reform, and these laws are one thing, but we have to execute on these laws. And that's what we're trying to do, is help the pharmacies take advantage of what's in front of them and build upon that with hard data and evidence of PBM abuse.
Well, I know that you've had just a few years in the industry. Why don't you let our listeners know a little bit about your background?
Yeah, definitely. So, Lauren, I've been working with independent pharmacy now for about 15, 20 years in various roles. My claim to fame is I've probably visited over 2,000 of the 19, 20,000 drugstores, with McKesson and BioLite, and ultimately just fell in love with community pharmacy and the mission that they have, seeing how they interact with their customers and explain medication and conditions to people that really need the connection and understanding, right? The mailman can't explain it like our independent pharmacies, a call center, even the chains that, they're busy and they're not told to come from out the bench and speak to customers. So I just feel like the authenticity of community pharmacy is something that's been a joy to work with. And I love the opportunity that we're working on right now with Pharmacy Marketplace.
And I was able to meet some of the individuals with Pharmacy Marketplace last year at the APCI show. And it was so interesting the way that Pharmacy Marketplace has really helped owners who are trying to make sure that they are not letting those dollars go out their front door. And so having Pharmacy Marketplace as that option for those owners is vital, because there's some owners that are similar to my dad, who's been a pharmacist for over 50 years, who really just wants to make sure the customer is taken care of, and we can make that up on other prescriptions. And that's really not the way that the pharmacy industry is going with these reimbursements right now.
Yeah, I call it the pharmacy spiral. It's a no-win decision that you guys have to make on a daily basis, where a customer walks in with a prescription, which in most businesses, that's great. That's an active opportunity to help a customer and make money, right? But in this instance, you run that in your software, see that you lost money, and you have one of three decisions. You can either send that customer away and pray that they don't take all their medications and their family's medications. You can eat the loss, which doesn't make business sense to me in any business. Doesn't take an MBA to understand that. Or you can search for that item in every item on the secondary market, which ultimately creates a challenge with your prime vendor agreement. And you never know when, that item and that secondary purchase is going to throw your cost of goods off. And, that's a frustrating situation to be in. So what we're trying to do is help pharmacies understand all the analytics that go into that situation, from sourcing the item appropriately based on those arrangements with your suppliers, to the other side of the coin, which is, well, if you lost money on that item and it's a commercial claim and it is covered through the state statute of being able to appeal through underwater claims or MAC appeals, then we want to help you organize that and file that appropriately to recoup that money.
And everyone right now is looking for any available dollar they can, whether it's through finding another source for that medication, whether it is through other services they're offering. So anything that you can do to partner with pharmacies on that is much appreciated. One of the things that we are most excited to talk about today is the MAC Appeal PBM reform tool that you guys have. There have been so many states that have come out in the last couple years with their own MAC Appeal language. And that's really to help those independent pharmacies across the state that are losing money whenever they are putting forward a claim and then, it goes underwater and that PBM is saying, oh, that's just maximum allowable cost. Sorry, we can go ahead and pay you well below what we think you should have. And so this tool allows the pharmacy to fight back against that. So I know that you've been working incredibly hard, and your counterpart, Kayla Copeland at Pharmacy Marketplace, have been working to educate owners on what they can do if their state does have favorable MAC appeal language on the books. Why don't you talk a little bit about this new tool?
Yeah, Lauren, this is so far the highlight of my career. I really feel like what we're able to do is address, stabilization of community pharmacy and help pharmacies recoup money that's rightfully owed to them, that the PBMs have created a lack of transparency and found loopholes to not pay, right? So as you mentioned, states are at various levels of statute enforcement on underwater claims. MAC appeal is one way to put it, but in some instances it's underwater altogether. And, they can't not pay you acquisition cost. So what we've done is we've developed a workflow in our software to identify that state specific law and essentially help the pharmacy from A to Z of filing a successful or correct appeal. And how we do that is we take the pharmacy management system EDI feed, and we take the wholesaler EDI feed, we marry it into our software, and we show the pharmacy based on their statute of limitation, which claims are eligible at any given time to file an appeal on. We then have created the opportunity for a downloadable invoice that meets the requirements of the PBM appeal process, along with everything that needs to be uploaded into the portal. Because most instances, the states have created a pattern where they say, hey, okay, the PBM has to give you an internal process to file an appeal, so you guys can try to rectify it before escalating it to the state. All right. So our system, it helps the pharmacy follow that process, and it cuts down the amount of time and frustration to do that. Which, pharmacies in the past have been like, it's all confusing. It's fragmented. I don't want to do it. I don't have time to do it. All right. So what we're doing is we're saving you time and organizing it for you there. Then what happens is we house the appeal, and we notify the pharmacy, okay, the PBM should have responded by now based on state law. So the law state, after a pharmacy files an appeal, the PBM has an allotted amount of time that they can respond. If they don't respond, then they're non-compliant with the statute. If they do respond, well, they're going to do one of two things. They're either going to approve it and allow you to, in most instances, reverse and rebill at your cost. So you recoup money back then. Yay, that's a success, right? They can mess with you a little bit. And what we do is Kayla and I will train the store on how to deal with that. But if the other action they have is to reject your appeal. Now, this is where most pharmacies give up, get frustrated, quit filing. What our system does there is help you escalate that rejection to the state enforcement agency. Okay. So each state has designed a process through these statutes that says, here's how we investigate a PBM statute or essentially the law. And that's done either through the Department of Insurance, the Attorney General, or in some instances, the Board of Pharmacy. Okay. And what we've done is we started this in Tennessee. Kayla, who you mentioned, is the brain trust of this operation. I'm just smart enough to find very intelligent women to help me. And Kayla is amazing. She had been filing appeals for over 2 years in Tennessee and created a 95-page manual to help train pharmacies on this. And I just said, Kayla, for us to really make a dent and impact in this, I need you to take your process and put it in my software. And that way you and I can go around and interview pharmacy associations and insurance commissioners and work with NZPA and PUT and ultimately get this to scale. And that's what we've been working on.
That is incredible. And I know that there's been a lot of changes over the course of the last few years of these MAC appeals because some of the PSAOs are no longer doing or offering that service. And so pharmacies who had relied on that now are looking for someone else to help lead them in this because they're trying to chase dollars all the way across their pharmacy. And so having an ally in this fight and having that 95-page manual and you and Kayla, who know this system very, very well, are able to help them. And the fact that you've kind of taken the guesswork out of what information is needed because you're able to marry that within your own pharmacy software information and the wholesaler information. So you don't have to hunt for an invoice. You don't have to do all of that. It already does that for you. And so you're able to submit that, and hopefully that will increase your chances of getting a favorable response as opposed to just an immediate rejection. That's really impressive.
Yeah, I think the key is, being able to create a process in software similar to MedSync back in the day, where when pharmacies were doing it on a piece of paper or a chalkboard or a whiteboard or Post-it notes, you're limited, right? You can do so much with the human brain. But when you empower it through software, you can really scale it and cut down the amount of time and effort and manual intensive labor. And what a lot of the stores have told us is like, look, I was very intimidated by this prior. Now you've laid it out to where me as the owner, I can learn this and in 30 minutes teach this to my tech, and they can take on this responsibility outside of workflow, obviously, but they can take on this responsibility. And there's, really a great ROI. And then the principle centered of, hey, we're just going to participate as well to make sure that the state has the information needed to enforce these PBM statutes and ultimately fine the PBMs if they're not being compliant.
Again, anything we can do in this fight for PBM reform is so impressive and incredible that this was the avenue that it kind of led you down. And again, having Kayla as that resource, she is so knowledgeable. I sat in on that webinar that you guys did not too long ago, and just the different ways that she was able to talk about the different states that also have that, you can tell that she has really been a resource for a lot of different owners.
Yeah, it's been a process, and now we've got it down to a formula, Lauren. Essentially what we do is we have a master document that has every state statute that has to do with underwater payment. And we have essentially digest all the timelines and the escalation process. And what we do is we reach out to the insurance commission or attorney general, whoever's on that enforcement statute, and say, hey, we're helping pharmacies follow this statute. We would like a minute of your time just to clarify some things. And Kayla and I interview them, show them the tool, and really read their appetite for enforcement. And we've seen some states that are saying, oh, please get pharmacies involved in this. The more the merrier, because we know that they're non-compliant and we want to use that data that your system has to find them and put out these audits and consent orders, because ultimately that's money back to our state. Other states are, they're curious about it, and they're like, hey, this is in our wheelhouse. We've not had a lot of participation, so we don't know necessarily how we're going to intake this, but your software seems to make it organized. So we are open to working with you. And I call those states the deer in the headlights, because essentially they want to participate and enforce, but they really don't know exactly what they're doing yet. So what we've been doing is introducing those folks to the states that have that passion around it, and letting them train them on best practices and what they're finding, and ultimately just saying, hey, look, they're not bad actors in a handful of states that these consent orders are coming out in. They're bad actors in all 50 states. The processes are no different. So don't think they're not doing the same in your neck of the woods. And that's been a positive experience, is getting a network together so they feel more confident in their enforcement levels. And then we have states that really have no appetite for this yet. Either they don't have a statute in place, or the enforcement agency is, seeing us as a liability that they're going to have to really start doing some work. And, that's unfortunate. But ultimately, our goal is to get pharmacies participating where the state has to take a stand, either positive or negatively. And that allows folks like PUT and the state associations and NCPA to go from there, right? I think all the time we want momentum and we want laws, and we get very emotional, and I'm there with you. I think this is one of the most corrupt, egregious system there is, but without black and white information to show where they're not complying, that falls on deaf ears with legislators sometimes. So what we're trying to do is commit to giving the pharmacies a tool to prove what they've been saying for years.
Hello, my name is Andrew Russell. I am the co-owner of Elko Newmarket Family Pharmacy, and you might recognize me from the PBM on the Rocks podcast. I am also a proud DataScan user of 6 years. We decided to use DataScan in our pharmacy when we first opened. We were looking for a software vendor that met a good price point, one that was easy to work with, one that wasn't too complicated starting out. And DataScan checked all those boxes for us right away. When we got in touch with them, they were on it. They wanted to make sure we were set up for success before we opened our door. DataScan is different from all the other software vendors that I've worked with. When you call DataScan, you get to talk to somebody right away, and they really genuinely help you fix your problems. Other software vendors that I have used, if you call, you wait on hold forever. You have to leave a message. They have to call you back. You go through a phone tree of options. DataScan is just hands down the most responsive software vendor that I've ever used. And I also can't say enough about how customizable the workflow is. It's very intuitive. The other thing that I like about DataScan, they support independent pharmacy and they support advocacy for independent pharmacy. They really do have the best interests of independent pharmacy in mind. And that is something that you cannot put a price on, but they have, and it's very low, which is nice. I couldn't think of a better software partner for an independent pharmacy than DataScan. I really can't.
DataScan Pharmacy Software. Independently owned software for independent pharmacies. Visit datascanpharmacy.com or call us at 877-222-7979 today.
And again, this kind of takes the guesswork out of how to do that. The states that you have seen success in so far, where are some of those states?
Yeah, I'd say there's about 10 to 12 that are extremely black and white, where, the states are, hey, if this appeal gets to me, then I'm going to enforce it if it's in a organized manner. So states like Tennessee, Arkansas, Oklahoma, Mississippi, Louisiana, now Iowa, Kansas just passed their law the other day that goes into effect July 1st, Colorado. So, that's a handful. West Virginia is another great one. And then you have the next level of states like, North and South Carolina and, Oklahoma, great state. I could go through, I'll send a list to you, Lauren, but ultimately there's probably a dozen very, very positive states, another dozen that are curious. They just have to have pharmacies participate. And then the other half of the country they have some law, but they've just had very little, conversations yet with pharmacy advocates or, participation in that law. So, our goal is to be responsible with this tool, prioritize the states that we know that it will work in, get that next layer going through pharmacy participation so those states will get confidence in enforcing, and then ultimately provide data back to the associations and NCPA to get the other half of the country, moving towards the direction of reform. And my thought is that federal law and programming won't take shape until the states prove, what's going on. So I would say, please be active in your state association. Please be active in NCPA. Continue to fight the fight with PUT, and ultimately, reach out to us to see where your state's at and what you can do.
And it seems like a no-brainer that the state associations should be in favor of this, because the money that is rejected in the MAC appeals is obviously leaving the pharmacies and that state and going to, a monster corporation out of state. And so this seems like this should be an easy yes, but there's a lot of groundwork that you do have to show that this data has been proven time and time again in those states that you are seeing success in, because it seems like some people are a little afraid of being, not the leader in this, but they're afraid of some of those opposition talking points that it will go and cause more money to leave their plan, leave their employer, leave their anyone. And they're just afraid that will come back on them and look bad on them. So we see a lot of that resistance is really just ignorance of the industry and how it works. Those states that you mentioned that are supportive of this are really a lot of them are the leaders that we're seeing in other PBM reform efforts. Arkansas, Tennessee, Oklahoma, there's no surprise there that they have seen what has transpired. They're tired of just finding those PBMs, and they're really looking for a way to make sure that money does go back to the pharmacies, and having approved MAC appeals is really the best way to get that back in the pocketbook of the pharmacy. So,
Lauren, it's so fun to see the transition of thought around those states where, they are like, oh my gosh, I have to enforce, they put in the statute that I'm the enforcement agency. Gosh, this is a responsibility, right? And after they really get to understand how this works, and and I've spent hours on the phone with some of these commissioners and investigators just explaining how drug supply chain works, right? And then they get to a point of like, no, this isn't a liability, but an opportunity to bring money back into our department through just obvious abuse of the statute. And it's, that's the most rewarding experience. And now you have states that are telling us like, hey, they're actively competing with one another. They're saying, hey, if the other state has more participating pharmacies on your software filing appeals, you need to let me know about it because we want to be number one in this area. And, that always makes me and Kayla just so happy, because there's a heavy burden we're feeling around designing this and making sure we do this responsibly and trying to get people to advocate for us. You have to thread the needle very specifically to make sure all the stakeholders are aligned here. But when you hear a state investigator say something like that, okay, we're not doing this for nothing. And, it's just been such a privilege to work on this for pharmacy. And I hope that, we can continue to collaborate with everybody, in the industry, because that's what it's going to take. It's going to take full collaboration to really continue this path. PBMs have relied on pharmacy fragmentation, and they've relied on loopholes and just confusing, frustrating processes to get you all to just give up and say, I'm not fooling with this. Why bother? And ultimately, that's not acceptable anymore. And states like mine and Tennessee are wising up to these processes. And we're seeing a fight where they're making bad enemies. The PBM lobbyists are making enemies of legislators in specific states. And that's, I'm no legal mastermind, but I don't think that that's the right route to go. So hopefully this will spread like wildfire and, we hit a tipping point where we'll get stability, and the people that own these drugstores and the people that work for you guys will have less stress in your life, and you can do more around your customers.
Amen. Let's hope so. And there is a big push in Tennessee right now. There have been some very dirty games going on with the CVS PBM divestiture bill that's really put out there. And we saw this happen in Arkansas. We saw this happen in Louisiana. The Attorney General in Louisiana was able to get a nice $45 million settlement because of some misleading text messages regarding a very similar bill there. I know the Tennessee Attorney General is interested in that as well, because their office has seen complaints come from all across the board about the different messages that patients are getting, different ads they're seeing. There was even social media influencers that were paid to do some campaigns for opposition for this bill, which is crazy. I never thought, TikTok influencer and CVS PBM antics would really go in the same bill discussion, but 2026 has been full of surprises. So I guess that's how the playing field is right now. But I know that there has been a widespread, diverse group of support for the Tennessee Pharmacists Association and, Senator Hirschberger for this bill, Representative Garhouse for this bill. It's just amazing to see the different ways that there has been support for that bill. These legislators are not afraid to step out in support of this and their independent pharmacies across the state. There's been practitioners that have also provided support and testimony. There's been just a wide variety of people that it's been really impressive to see Tennessee come together that way.
Yeah, definitely. I commend Anthony Pudlow and the association and everybody behind the scenes that have helped him in support of building this momentum. I think that, obviously NCPA, you guys, and just all the information to get pharmacies passionate and aligned. We've been trying to support through some data analysis and letting, folks know when CVS's PBM portal has been down, or when they're increasing copays on customers that are unlawful when they do approve an appeal. Just there's ways that they're not being compliant. That's I'm sharing, and ultimately what we see is this is going to pass in Tennessee, and they are doing everything they can to try to rile up their customers through pretty abusive tactics, right? And the AG in Louisiana said that was unlawful, and I think our AG has come out and stated hey, you cannot use your customer database for this. But yeah, it's been to the point where now they are actively running commercials on behalf of going against this bill and saying the legislators that are on these committees voting yes for this bill are going to take away pharmacy access, or take away, just putting them in a bad light. And ultimately that is dirty in my opinion. And I commend the legislators for standing their ground and being courageous, because they see that this is monopolistic practices, and ultimately they will stand on business around that, even if they're getting attacked.
So, Kris, if anyone is interested in the Mac Appeal tool through Pharmacy Marketplace, or anything that we've discussed today, how can they best reach out to you or Kayla or get involved?
Yeah, we're very accessible. They can either contact me at chris@pharmacymarketplace.com, or they can go on our website. Kayla and I have put some videos on there and some general education. There, just go to pharmacymarketplace.com, and ultimately that is a link to a demo. That is the webinar that you mentioned, Lauren, that you attended, along with a video of why Kayla helped us in the first place, right? So, her, um, Anderson Drugs is where she is based out of. Jeff Anderson was a huge advocate in PBM reform in Tennessee. When this law passed, he said, Kayla, I give you full reign to spend as much time as you need to file these appeals. And Kayla, for the first 3 months, was super, frustrated from the rejections. But she kept fighting and refining the tool in her process. And she was such an asset to be able to help us with the software. And ultimately, she's been so amazing going state by state and designing the training modules per state. And, pharmacies are reaching out to her like, what do I do with this rejection? And what, is my rights now? And Kayla has been so gracious with her time to, answer every individual question. I'm like, you're going to burn out, girl. We have to figure out a way to, get your answers in a little bit more scalable form. But ultimately, it's just been such a privilege. And if you guys reach out, any of your audience, any PUT advocates to us through the website or just email me, we'll make sure that we help you understand where you're at with your current state law and what you can do to advance it. So.
Well, Kris, thank you so much for your time. This has been incredible to, like I said, get a little peek behind the curtain as to what this new tool from Pharmacy Marketplace really entails, how it can help owners fight back against those dwindling reimbursements and get back the money that they deserve to have for the service they're providing. So thank you for your work. Thank you for Kayla for being a wonderful resource. And we look forward to talking to you again. If you have any questions about anything you've heard today, you can reach out to us at putttruthrx.org. Happy to help you with any future questions that you have regarding this. And I really appreciated Kris's message of getting involved, making sure that you're informed, helping your legislators get informed, making sure that you're able to join the fight with us against PBMs. Again, you've been here for this episode of the PUTTcast. I'm Lauren Young with Pharmacists United for Truth and Transparency. Have a great week.